with what we knew before your new study. We knew that hypo and hyperfibrinolysis after traumatic injury are both associated with poor outcomes. And we knew that we could measure fibrinolysis using thromboelastography. We also knew that empiric administration of tranexamic acid to inhibit hyperfibrinolysis can improve outcomes. But the ways in which early changes between lysis states affect clinical outcomes and the impact of tranexamic acid are not well understood. So your group set out to use rotational thromboelastography, or ROTEM, after major trauma to better understand changes in lysis states and their impact on outcomes. What was the original hypothesis of this study?
So using a large cohort study that we've been running for over 10 years now, we've been particularly interested in understanding both the natural history of fibrinolysis in trauma, but how tranexamic acid may modulate that response, and equally how both of those two things, both tranexamic acid and the fibrinolysis that's occurring in response to injury, impacts clinical outcome. So we can understand a little bit more about who should perhaps receive tranexamic acid and actually what those changes in the dynamic process of fibrinolysis over the early phase after injury, what that actually means for the patient that we see in terms of clinical outcomes such as multiple organ failure.